Hey everyone, and today this video is going to be a bit more ad hoc, a bit more on the fly, and I'm not going to post a bunch of studies and throw it at you on the screen. It's just going to be a bit of a discussion. The allure of experimental treatments mostly comes into play when people aren't getting the sort of growth that they're expecting from just the typical oral finasteride or even oral dutasteride plus topical minoxidil stack that, it's like the entry stack to facing androgenetic alopecia. And people sometimes aren't patient enough to see regrowth, or maybe they have their ideas of how much hair they can get back a bit skewed. To give you some sort of an example, you'll have some guy who's a Norwood 4 thinking that if he takes finasteride and dutasteride, he'll get a Norwood 1 hairline or some sort of density that's comparable to his adolescent years. And I'm sorry, but just because you saw some guy on Trestless or some online hair loss forum achieve that, and by the way, that's a hyper responder right there, that doesn't mean you're going to get the same reaction from your particular hair loss stack. You have your own idiosyncrasies, like your genetics, playing against you here, and you don't have the same genetics as the other guy who had that phenomenal hair regrowth. Not only that, but factors like age and when you actually started in your treatment, and by started I mean at what level did you begin your hair loss stack, might limit the regrowth potential you'll have. So you have to keep things in perspective. At best, you can hope to maintain what you currently have and maybe get a little bit of regrowth. So the allure of these experimental treatments often stems from desperation when the standard treatments fall short. And additionally, the promise of innovation, compelling anecdotal evidence, perceived limited side effects, and the inclination towards holistic or even so-called natural solutions could also be powerful motivators. But diving into these experimental avenues without in-depth research poses several risks. The efficacy of treatments remains largely unproven due to a lack of rigorous clinical trials. Now, we have kwxsoc or pyrrolidamide, we have CB0301 or clascoterone. Clascoterone has already been approved for the treatment of acne, but not yet for androgenetic alopecia, and I think they're currently in phase 3, Cosmo Pharmaceuticals, with their brand Breezula containing clascoterone. They're currently in phase 3 for the treatment of androgenetic alopecia. But then you have more experimental things that we don't even have the clinical evidence for, whether it's RU58841, where we actually did have clinical trials, but they were never published to the public, or something like Floridil, which, although it has had clinical trials and it has a safety mechanism, it hasn't necessarily been proven by the FDA or the EMA for treating androgenetic alopecia, but its functional mechanisms indicates that because it blocks that androgen receptor, that it would ameliorate or slow down the destructive effects of DHT to the hair follicle. But then we have people taking a bit more of a risky path, doing things that involve changing your entire hormone profile. And I'm talking about that, there was this one particular post that I saw on the internet about some dude doing a Nandrolone replacement therapy on top of taking estrogen or something like that. Like, there was this one guy on Trestless, and he says in this particular post, he says, "Greetings all, I've been on finasteride for maybe 4 months now with 0 side effects. But as many of you know, it's not just DHT that attacks the hair follicle, it's androgens like testosterone. Also, when transitioning from male to female, men are able to regrow full heads of hair. This has been seen time after time." So the dude says you can use Nandrolone as a replacement to testosterone, and then he goes on to talking about how there are many anecdotal reports of full hair regrowth in the bodybuilding community regarding Nandrolone as a replacement for TRT. So he wants to change his entire hormone profile, eliminating testosterone and just running solely on Nandrolone. And Nandrolone, for those of you who don't know, is an anabolic steroid. Nandrolone itself doesn't directly convert into DHT. However, there is a pathway that can metabolize Nandrolone into a related compound, which would be DHN, by that enzyme 5-alpha reductase. And that's the same enzyme that converts testosterone into DHT. But DHN is less androgenic than DHT. So I guess their idea is, because you're not going to have DHT as prevalent in your system, and also you're not going to have testosterone in your system at all because you're solely running on Nandrolone, that means you'll be able to keep your hair follicles. Now, it's faulty premises like this that contribute to people taking potentially dangerous routes to treating their androgenetic alopecia, because the idea that testosterone is still causing damage to the hair follicles, which is why people are still losing their hair, is a bit of a faulty one. Testosterone doesn't exhibit the same effect as DHT onto the hair follicle. And I think Hair Cafe, Kevin Mann, made some videos detailing on this, and I'm not going to get into this in this particular video. I just want to make that as a statement. Really, it's your concentrations of scalp DHT. It doesn't matter if you crush your serum DHT well below 90%, you'll still have scalp DHT, and sometimes even with dutasteride between ranges of 0.5 to 2.5 milligrams, you'll have a crash in your serum DHT by upwards between 90 to 99%, but your scalp DHT would go from 50 to 80%. Even at 2.5 milligrams, you'll have a reduction of scalp DHT by to 80%, but you still have that 20% scalp DHT. And in some men who have very severe genetics, it's unfortunate, and again, this doesn't represent everyone. I think most people who freak out are just impatient. But in some men, even having that 20% remainder of DHT is still enough to, over time, cause damage to hair follicles. But then they wrongfully assert that it's testosterone that's causing damage to those hair follicles. And then they go ahead and replace their entire hormone profile with Nandrolone, doing this expensive bullshit when they could just take a step back and actually think a bit more critically. But again, it is that desperation that drives people into taking that particular route. And there are some gray market, I guess you can say, hair loss stacks that you can look at that are a bit more rational. Like I mentioned before, when it comes to scalp DHT, that is the primary point of concern in addressing your androgenetic alopecia. So you really need something that can go into the hair follicle and block that androgen receptor from ever coming into contact with the DHT. And I'll probably touch on this in a future video, but then in order to actually formulate a hair loss stack that can actually accomplish this, you're probably going to be looking at the affinity of certain topical anti-androgens to the androgen receptor. You'll have the question like, how can we use a topical anti-androgen effectively if topical anti-androgens tend to be less potent and have a lower affinity for the androgen receptor compared to dihydrotestosterone, DHT? And I'll come back and say, well, you need to focus on saturating your scalp with a topical anti-androgen. And this is where the whole experimental thing comes into play, because people will then resort to using RU58841, resort to using pyrrolitamide, and RU58841 doesn't have any published, like I mentioned before, it doesn't have any published human clinical trials, although they have been completed, but we don't even know the full extent of its safety profile. And pyrrolitamide is still in clinical trials in both the United States and China, but then again, it still has some human clinical safety data. At the end of the day, you're still messing with things that haven't been fully approved for androgenetic alopecia, so this is what makes them a bit more gray market. Furthermore, you have to rely on gray market unapproved laboratories to manufacture many of these products. And as we've seen in the supplement industry, there are a lot of shady products that purport to have active ingredients in their specific products that they sell, but in reality they have none. And you take a risk when you're contacting a random lab in China, the Czech Republic, or the bathtub of some Cambodian guy, because you're not sure if you're actually getting a consistent and quality, pure product. Now, some gray market labs are much more legit than others, but this is the issue you run into, the legitimacy. You don't have a government that does routine surprise checkups on these labs. So when I look at this, I would say realistically, the only FDA-approved topical anti-androgen that we currently have for the treatment of some sort of androgenetic skin disorder would be clascoterone, or Winlevi. That's the brand name it's sold under. And that androgenetic skin disorder wouldn't be androgenetic alopecia, but rather acne. Acne is a byproduct of DHT because DHT likes to make the sebaceous glands more active than they otherwise would be. So in my opinion, clascoterone would be that sort of safer of the so-called gray market drugs. And I'm just saying that's my opinion. But I hinge that on the fact that it's already been approved for acne, and currently it's under phase 3 clinical trial by Cosmo Pharmaceutical under the brand name Breezula. Personal freedom and autonomy in making choices about one's body and health are paramount. If someone after thorough consideration, chooses an experimental route, this decision should be respected. However, the responsibility to be well informed rests both on the individual and also the medical community. And in much of these videos, I mostly speak for myself, but I also encourage people to do their own research and actually, take agency in their own treatment and their lives, pretty much. It's vital for those considering these treatments to be cognizant of the potential risks and consult with trusted medical professionals, not just me, because I'm just a guy with a microphone who has access to Wikipedia and other resources. But most definitely, you can talk to endocrinologists, you can talk to chemists to actually learn about how these sort of chemicals would in theory interact with the human body before you make any sort of personal decisions on your own treatment. So I do encourage people to look at things that are a bit more FDA approved. Certainly, I also like to venture outside of the FDA approval bubble, but I don't want to go too far, like that stupid fucking Nandrolone replacement therapy to get... That's the dumbest thing I've heard. You're doing that, I mean, I think you're going to be on TRT for life, if I'm not mistaken, but that's not a good idea. So anyway, that's pretty much it for this video. And if you got to the end of this video, comment in the comment section below, apple juice. Yes, apple juice. Such a simple comment that we always put at the end of these videos to see who actually got this far into this video. And I feel like I kind of like this type of video, the more casual, where I'm talking to you, the casual setting, I guess you can say. It doesn't really involve me going out and finding all these studies to throw at the screen. And I don't even know if you guys actually look at the fucking studies and read it when it's on the screen like that. But in any case, I do appreciate you being here. So thanks for watching and thank you for the support. Remember, comment apple juice if you got this far in the video. Thank you and see you on the next one. Peace out.